Good afternoon, everyone. My name is Fahad Shahid, and we welcome you to another important webinar of Prime Health. We have here with us today Dr. Surpi Jain, who is a specialist cardiologist currently practicing in Prime Medical Center, Burjuman. Dr. Surpi Jain has an extensive experience of 11 years in cardiology, and for the last 2 years, he's been practicing in UAE. We've got a lot of knowledge to understand and to to get information from Doctor today. And a very important topic today here that we have is early recognition of heart attack, because heart attack is more common now, not only in the elderly people. It is there with the people who are in their early 30s. We talk about people who are in their 20s. So we're going to talk about how this happens, how does this work, and why is it so common nowadays. So to just understand that, and of course how we can really take care of it, early recognition, as I said, it really needs to be understood to all of us. And a very special information on the insights of how fasting affects the heart and blood pressure, how beneficial it is for us. Dr. Supriy is going to cover all of this today in his talk. So thank you very much, Doctor, for joining us today here.
Thank you.
It's really great because it's a very important topic, Doctor. I'm not going to take much time, so I would really request you to please give us an introduction to the topic on early recognition of heart attack, how it goes on. Thank you.
Thank you, Dr. Han. Just before starting, it's very important to understand what is heart attack. It is a sudden onset chest discomfort due to the decreased oxygen supply of heart muscles. In simple terms, it happens when blood supply to the heart muscles decreases, is less. Why it happens? Because of commonly it is because of the blockages of our artery, which we call in general terms. What are the blockages? It is the atherosclerotic obstruction of the arteries. Okay, what is the atherosclerotic obstruction? It is the combination of cholesterol deposition plus superimposed blood clot formation. So what happened during a heart attack? How it comes, how it builds up? Initially, patient usually feels some chest discomfort, mostly in the center part of the chest, but you cannot localize from where it is coming, but the chest discomfort is there. Rarely it's a pain to start with. It's a chest discomfort, burning, suffocation, and uneasiness. And gradually it radiates progress towards the throat, jaw, neck, to the left arm or to the both arms. And it typically, the whole episode begins rapidly, and within 20 minutes, patients is totally in too much of trouble. It is associated with some other system symptoms like difficulty in breathing, excessive vomiting, sweating, sometimes dizziness, loss of consciousness. So we have to be very careful if any of those symptoms, if they present like this, we should be alert that it can be a heart attack. So we should be very much in total awareness of this. So does that heart attack happens all the way in the same persons like male, female, like old age, young age? No, it doesn't actually. Those who have old age, those who have diabetes, females, they may not present typical. They may not present in typical fashion. They can present with sudden onset, shortness of breath, unexplained vomiting, or dizziness, or jaw pain, or arm pain. These symptoms are atypical symptoms. They can present commonly in old age, those who have diabetes, or those are female gender patients. When we should not worry, there are some pain where we call them atypical chest pain. They may not suggest heart disease, but you should evaluate them with your doctor's advice. What they are? If somebody feel pain on deep breathing, if one can localize the pain with a particular point finger, if the pain doesn't comes on walking but happens only rest for long periods, if the pain lasts for seconds and then disappears, pin pricking pain, constantly changing its position, these all are usually non-cardiac pain. but they can be a part of a cardiac pain rarely. So better you should take a doctor's advice and proceed accordingly. As we know, the heart attack is a leading cause of deaths worldwide. If you don't have any heart risk, any risk factors, means the optimal risk factor profile, then there is a 3.5% of getting the heart attack in male patients, where it is less than a 1% in female. If you have 2 to 3 risk factors, then the risk multiplies. Then if the male patient, there is around 33%. In the female patient, it is around 15 to 18%. Now, what we do once a person suspicious of heart attack? Suppose you are at home, you got this problem, immediately call the ambulance. Don't move, don't get panic. Just sit comfortably and open your mouth, take deep breaths. Don't walk, don't exert. Just be cool, relax, and sit in a particular place. If you are feeling some dizziness, lie down in left lateral position. Means lie down on the left side of your shoulder, left side of your body. Don't get panic, or don't walk, don't run, don't do anything. Just be stable at a particular point and wait for the help. And if you feel that you have a typical symptoms, you have a risk factors like diabetes, hypertension, you can take the aspirin as well. Once the help arises, the cornerstone for the diagnosis of heart attack is the ECG. If ECG is characteristic, then the blood test and echo are the supportive findings. So if the ECG is characteristic, immediately shift to the hospital and treat it accordingly. In the hospital, treatment consists mostly in the 3 parts. One is the pain reliever, another one is to blood thinner medications, and the medications which prevent the decreased supply, or in the way it improves the blood supply to the heart. Those medications include blood thinners, some procedures like angioplasty after the angiogram, and the bypass surgeries. And the last important thing is the other medication which prevent the sudden death, especially in the heart attack patients, and also prolongs the life, like the beta blockers and some more medications like ACE inhibitors. So, what is the causes of these blockages? As I started with atherosclerosis. Why it happens? Because of the deposition of cholesterol. Why it happens? There are some risk factors are there. We call them modifiable and non-modifiable risk factors. Modifiables means we can change them. Non-modifiables means we cannot change them. Like your age, your gender, your family history. These are the non-modifiable risk factors. You cannot change them. It will be with you for always. The others are the modifiable, like smoking, like physical inactivity, obesity, diabetes, blood pressure, high cholesterol, mental stress, excessive alcohol intake. So all these are the factors which you can modify, which you can control and prevent the heart attack. These risk factors, they doesn't add 3 plus 3 like 6. They multiply 3 into 3 like 9, and then 99. So if you have 2, then the risk multiplies, not added, it multiplies. So keep your all the things within the control. Like for blood pressure, keep your BP within the normal range, like it should be less than 140/90, preferably 120/80. Sugar within the normal range. Keep your HbA1c level within the normal range. Third thing is your cholesterol levels. You should know your good cholesterol and bad cholesterol levels. Good cholesterol is HDL cholesterol, that should be more than 40 in male patient, and at least 40, more than 44 in female patient. And the bad cholesterol, we call it LDL cholesterol. It should be around 100 only. If it is crossing 150, then you may require medication. Take your doctor advice to take the medication for the cholesterol. If it is in between 100 to 150, try to do more physical activity, restrict your fat intake, and try to maintain within the normal range. See, our fat is the cholesterol, 2/3 of the cholesterol is produced by body, 1/3 we take it from the diet. So everything has its own part. Reduce your fat intake, do more physical activity, and keep your cholesterol levels within the limit. Then the physical activity, at least do 40 minutes brisk walk every day. You don't need to go gym, you don't need to do heavy exercise. Just do brisk walking 40 minutes every day, or at least 150 minutes in a week is sufficient to keep your heart healthy. Another important thing is your weight. Your weight should be within the normal range. If it is high, try to lose your weight. Try to do some calorie restriction, fat restriction, and do more physical activity to control your weight. Smoking. The smoking is very important thing. Smoking multiplies the risk of heart attack. We should not do smoking. And the smoking, there is no substitute. You have to quit the smoking. Not only it gives you the heart benefit by quitting the smoking, it also prevents you from number of other cancerous diseases as well. Then you should know about the new smoking. What is new smoking? New smoking is physical inactivity. If you are keep sitting in your office, keep sitting in your chair, like nowadays most of the people are working from home, sitting long periods on chair and table, not doing any exercise, not doing any physical activity, we call it new smoking. So you should avoid that. You should do proper physical activity, exercise, brisk walking to avoid heart attack. And then the alcohol consumption. You should not take excessive alcohol. Permissible limit is 2 standard drink for male and 1 standard drink for female per day. If you take excessive, then you may require gastroenterologist as well as the cardiologist. So overall, you have to keep all these key risk factors within the control. You just incorporate all these activities in your daily routine life. You need not to do a life which is of no interest, which is of no food. Just try to keep these good things, incorporate these good things in your routine life to maintain your risk factors within the control. So this is very important part. If you keep your these risk factors in control, you may not get heart attack. Thank you.
Thank you so very much, doctor, for giving us a detailed information on a very special topic today. I would like to request to all the viewers who are watching us currently at this time, you can always ask a question to Dr. Supriy in the comment section, and doctor is ready to answer your questions live. Doctor, I've got some questions here. I would like to ask you those questions so we can proceed further. Dr. Asia Nabi is asking, I have one patient. His father died on cardiac arrest at 40. He's currently 45 years, and since 10 years, he takes statin 5 mg. His all reports are normal. Should he still continue Lipitor 5 mg? All other cardiac parameters and BMI normal. He has grade 1 hypertension.
Okay, so now as your history is very clear, he's having a very high risk of cardiac disease. He's on very high risk since he's got a premature family history of heart disease. One thing, second thing, he's dyslipidemic. Third thing, he's on borderline hypertension. So best way is to continue the statin. Don't stop the statin, because very importantly, these statin, these cholesterol blockages, they start happening when you're 10 years of age. So it's very surprisingly, but they start at 10 years of age, and gradually they progresses when the your age is 30 or 40, then it's become massive. So continue with that.
All right, thank you, doctor. Doctor, I've got a question here. Let's talk about a scenario here. A person with the treadmill test. What do you call that? A treadmill test it's normal. Uh, After how long? What is the interval of time that when he should do another test just to check that whether all is okay? I mean, like if there will be any changes that will come, how much time it takes to appear those changes, to get those changes in the body?
See, today's treadmill doesn't guarantee that you cannot have heart attack tomorrow. This is very important thing. See, the blockages, they can appear very rapidly, and the blockages which are 30-40% will give you the treadmill test negative. But what happened with 40% of the blockages, the inner lining of the blood vessels, they get rough. not the smooth. Once the blood they come into the contact with the rough surface, it tends to become clot. Once the clot form, artery is got 100% blocked and you get a heart attack. So best thing is whether your terminal test is negative doesn't mean that you are free from disease and you should leave your all lifestyle modification. You just continue your risk factor modification thing. You should not like my treadmill is okay, my LDL is okay, so I can eat anything. I no need for exercise for me. It's not like that. Just continue, just maintain your good lifestyle habits. Otherwise, they come very fast.
Great, thank you.
Thanks.
Thank you, Doctor. Doctor, another question from Mr. Wellens. He's saying, what should be the ideal weight or BMI for good heart health?
See, the BMI range is 18 to 25, and preferably you should keep it in the range of 21 to 23. That is the ideal BMI. Or if somebody doesn't know how to calculate BMI, just it's a rough idea. You can simply detect 100 from your height in centimeters. I suppose somebody's height is 170, you can simply detect the 100, so it will come 70. 70 is your upper weight limit, one thing. And the third thing is the waist and the hip ratio. That is also very important.
Thank you so very much, Doctor. We've got some questions that came before the session. When we registered the patients, or I should say members for the session, I've got a question here from Mr. Muhammad Abdul Majid Khan. He's asking, I'm taking Nibrit, pardon me if I'm pronouncing it wrong, tablet daily to control high heartbeats and blood pressure. Do I have to take this for life or I can't stop? If yes, when?
Okay, see, you are on Navilet. It is nebivolol. We call it beta blocker medication, and it controls the blood pressure as well as the heart rate. Okay. Now, if your heart rate and blood pressure is well controlled on medication, then no need to change anything. Continue with the same medication. Suppose if your heart rate and BP is going low, then only you need to stop the medication. The things are controlled because of the medication. Once you stop the medication, you will be again on the same day from where you started. So continue the medication, and continuing the medication will prevent you for the damages like going high BP, high heart rate, all produces damages to the heart.
Thank you very much, Doctor. Mr. Sachin has asked, please advise on preventive annual tests for preventing heart-related ailments.
See, every society in the world has their different recommendations. Somebody advises a blood sugar test every 5 years. Somebody advises every 2 years. Somebody advises every year. So if you don't have any of these factors, means low, no cholesterol, no sugar, nothing is there, no blood pressure, then you can do once in a 5 year. If you have risk factors, then you should do once in a year.
Thank you, Doctor. I believe an important question. How do you differentiate a gastric pain on your left, on your chest, or it's a heart attack? How do you differentiate? Because a lot of people think that this is just because of maybe some gas or something, the pain is there, but sometimes it turns out to be a heart attack. So how do we differentiate if a normal person sitting at home wants to understand that?
See, it's very tricky question. It's also a very tricky question, a tricky situation, even for the doctors as well. And it is difficult to differentiate simply on the clinical ground. You have to see a doctor, because what happened with the this what do you call gastroesophageal reflux, you'll feel the esophageal spasm, and that spasm gives you the feeling of constriction in the chest. Same feeling of constriction of chest you'll feel with the heart attack only. So you better visit to the doctor instead of making means waiting for anything. And the other thing, if you feel the other associated symptoms, like it is coming to the throat, neck, moving to the arm, associated some sweating, better you suspicious of heart problem. And especially if you have the risk factors, then you should not wait.
Right. Thank you, Doctor. I've got a question here from Ms. Prachi Singhal, and she's asking, my mother is hypertensive and diabetic with little high uric acid. She's 65 years old. Any lifestyle changes can help to get rid of cardiac arrest instead of having medication for heart in initial state? Please advise. One more question. That's a follow-up question is there. Due to pandemic, elderly people can't able to go out for a walk and work out. Is there any specific lifestyle change which help them to manage, HDL and LDL? So we've got two parts of the question. One is for the mother. She's 65 years old. The details are there. Any lifestyle changes to get rid of a heart attack. The other one is because of the pandemic, elderly people aren't going out. So how do you look into that?
See, the best thing is to do the regular walk, right? Even if you are at home, you cannot go outside. Just try to walk in your room, whatever space is available, at least for 30 minutes, and try to minimize your calorie intake. Don't sit for a prolonged period. Just keep walking whenever you have time, whenever you are in a position to walk. Just the important thing: don't walk after your major meals. At least 45-minute rest is must after the major meal. Then only you should walk. Regarding the medications, if Prachi asked that her mother is having diabetes, blood pressure, everything, the important thing for her is to keep the numbers within the control. Like blood pressure should be within the control, and 20/80, sugar, cholesterol, everything should be within the control. And if it is controlled with the medication, should continue the medication, should not stop the medication because they are controlled by the medication only. Without the medication, the things are controlled, then rapidly the blockages comes. So important thing, our risk factors should be controlled. Whether you are able to achieve to control it through the medication or through the lifestyle motivation. Our main aim is to control them. It's not how we are controlling them. That's very important. Some people say, no, I can control my blood pressure and by reducing weight, by salt. And see, the important thing, once you reduce them, once you achieve the target, you have to maintain that. It doesn't mean that you have reduced everything and at 2 3 months you are okay, and then after 3 months again the things get back to the previous level, like weight again start rising. Then it's a problem. So better you should keep all the risk factors within the normal range. That is BP 120/80, HbA1c level less than 6.4, LDL less than, try to be at 100, HDL more than 44. It's very important. So I think she should continue the medication as well as the brisk walking.
Doctor, the pandemic part of the question, uh, the second part of the question was.
Yeah, as I said, the initial my answer was for the pandemic only. Just walk at the home. No need to go outside. If you cannot go outside, better walk at home. At least 30 minutes in a day. Try to do some brisk walk, and don't keep sitting for long hours. And try to reduce your calorie intake since you are not fully working. But try to reduce your calorie intake as well.
Thank you. I've got a question from Dr. Arpita. She's asking, my LDL is around 140. Should I be concerned?
Thank you for asking, Dr. Arpita. Your LDL is 140. See, if it is crossing 150 limits consistently, then you should take medication. If it is 140, then you need to do some lifestyle changes, reduce your fat intake. Importantly, you should not eat fried too often. Once a while is okay, but on a regular basis, you should not eat the fried things. You try to avoid try to consume good quality of oil, like the 6 7 types of oils are recommended by the AHA, like canolas, safflower, sunflower, rice bran, the olive oil, mustard oil. These oils are a good oil. You can use them and should not use the one oil for a long time. Jumble them, like every 2 3 months change your oil, and try to avoid all other the fatty things like butters, cheese. And if it's still not controlled with all these things, then you can try some medication.
Thank you so very much, Doctor. Miss Karna is asking, is it true that if you feel the radiating chest pains and headedness that often signal a heart attack, you can keep yourself conscious by breathing deeply and coughing vigorously? Is coughing will help during heart attack?
See, there are 2 3 parts of the question. First is the radiating pain. Okay, the radiating pain. Importantly, the pain of the heart, it usually never crosses your nape area. Means it doesn't goes to the head, and in the lower down doesn't crosses the navel. Doesn't go crosses that level. So between this part, it is the pain usually radiates from the heart, not above that one toward the head, not below the navel part, the umbilicus part. And second thing, she is asking about the coughing during the heart attack. We call it self CPR. If somebody is feeling excessive difficulty in breathing, and sudden onset chest pain, suffocation, then yes, it's a perfect way to maintain your saturation. Just sit comfortably and do vigorous coughing. So by that doing, your pulmonary pressure and pulmonary edema, the fluid accumulate in the lungs, that decreases. So by the time you'll get the medical help, you can maintain your oxygen levels in the blood.
Thank you, Doctor. Thank you so very much. Doctor, as we are into the month of Ramadan, so I just want to understand if you can just give a brief on how important it is, or how beneficial, I should say, it is that when you fast, and how do you control your hypertension and the blood flow during fasting? Is it really good for health?
See, intermittent fasting, recently published one study in New England Journal of Medicine has shown that intermittent fasting is very good for the health. It keeps your good hormones in the body and decreases the bad hormones. So you can continue with that. But importantly, you just keep your hydration maintained during the fasting. Hydration maintenance is very important. If your hydration is not maintained, then the chances of the heart disease rises.
All right. So during the fasting, the hydration has to be there.
Yes.
That's very important. Okay, great. Doctor, a lot of people during at the time of iftar, especially in this month, it's a habit, especially in this part of the world, or I should say in the Asia part of the world. People eat some fried food, actually, a lot of fried food, in fact, not little, even though they are taking medications. So, what do you have to say on that part? This will affect for 30 days if a person is continuously having fried food, just at the opening of the fasting.
Yeah, definitely it does affect actually. See, at least in normal general way, what we recommend is five serving of the green fruits and vegetables in a day. So if during the fasting you cannot do that, so during the iftar time you can have more green fruits and vegetables. So that should be your what you can say essential part of your food. Instead of fried, you can have some part of a fried, little bit is okay, but not the chunk of the food. It should be the fried one.
Right, right. Thank you, Doctor. Doctor, just a question, quick interpretation of lipid profile. That
Mhm.
will be really highly appreciated. A request from Dr. Asif.
Thank you for asking. See, we usually order the lipid profile in fasting just to check the triglyceride level. Importantly, what are if you see the lipid profile reports, total cholesterol, triglyceride levels, and then the HDL levels, then the LDL levels, and the ratios. If your HDL level is on lower side and your triglyceride is on higher side and LDL is on lower side, this is the typical lipid profile report from the most of the Asian origin people. This is very bad report. The important thing is HDL should be high. If it is very low, it is equally and equally, not equally, it's a much dangerous part. So wherever, if you see the Western population, your LDL goes high as compared to the HDL and triglyceride level. So what are the numbers for them? Suppose the triglyceride level is too high, then only you start the medication which are very specific to the triglyceride. Otherwise, if it is a moderately high, then you start the medication with the statins only, the drugs which keep the control with the LDL as well as the triglyceride level. So try to keep the LDL level around 100, but should not start the medication until it crosses the 150. Earlier in 2014 guideline, it was around 170. Now it is around 150. So try to decrease it below 150 level. And see, first of all, if it is a borderline, no other coronary risk factor like another non risk factor like diabetes, hypertension, smoking, then try to do it with the diet only. As I discussed, that one third of the cholesterol is produced is taken up by the diet, and two-thirds is produced by the body. So if we cut down the oral intake, even then the cholesterol levels are high, then we should start the medication. Or if you find the cholesterol levels are, one going starting it's too high, like LDL is more than 200, 250, better than start the medication. Similarly, for the triglyceride level, we should look for the other causes like diabetes, hypothyroidism, the drugs like the diuretics. They all causes hypertriglyceridemia, as well as the diet part of the patient. If you see if everything is controlled, even then the triglyceride level is high, then we should start the medication. And the
Right.
HDL level, there are no specific medications for the HDL. So many medications they introduce, so many studies done, but none of them was very much useful. So best thing is for the SGL is to do the physical activity, more physical exercise.
Right. Doctor, as we are moving towards the end of the session, just a quick question on how do how much actually I should say a person just to keep the healthy heart, how much exercise needs to be done in a day, or if people have less time in a week, if you can tell us.
So target is 150-minute brisk exercise in a week. So most of the time in a week you should do exercise. Exercise doesn't mean that you have to go gym and doing the weights and all. These are called isometric exercise. What we want to do, we want to do isotonic exercise. What are those? Simply running, jogging, swimming, brisk walking, cycling. These all are isotonic exercise. These exercises are good for the heart. So any one of them, do it at least 45 minutes in a day and at least 5 days a week. That is sufficient enough to keep your heart healthy.
Doctor, just following up on the previous question, how about the people who are, involved in playing cricket or basketball or any of these sports apart from isotonic? I believe. What do you have to say on this part?
See, about the exercise part, it has to be done 45 minutes regularly. It's not like that you walk for, say, some people, there's some patients, they come and ask, I'm walking 1500 steps in a day, I'm walking 1600 steps in a day. That doesn't matter.
Oh, okay. Okay.
That is your routine part of life. The important thing, you should walk 40 minutes in a single go. It's not like 10 minutes morning, 10 minutes evening, 5 minutes in the afternoon. It's not like that. It has to be in a single part. So, like as you said, cricket. Most of the time, you are sitting in a one particular area in the field. Yeah, suppose you are a fast bowler. After over, then you will be off, right? So that doesn't give you the perfect exercise. So, like basketball, yeah, definitely basketball is much active sport. Tennis is much active sport. Definitely, those sports helps.
Perfect. So that means what I understood is that we need to have a 45 minutes of an exercise that would really be there,
Yes.
rather than taking 10,000 steps in a day, but in different timings. That won't
Yes,
be
yes,
effective
yes,
that much, right?
yes.
Thank you so very much, Doctor. Doctor, you've given us a lot of information today. Thank you so very much for all the information that you've given. It was really a great informative session, and we'll be looking forward to do some more sessions on heart health, especially. I thank to all the viewers who are watching at this time, and obviously, I'm sure the questions that were asked, they are answered very well by Doctor, and I'm sure people will get benefit out of it. People who will be watching this session after the live is over, it will be definitely a very important session for them also. We always tell that your recommendation is important for us. Please give us a feedback with your reviews on Google reviews and Facebook page Prime Health. That will be really helpful, and you can always subscribe to our Prime Health channel on YouTube. That is there, which will have lots of informative videos from our doctors on different informative and important topics in this very pandemic situation. You can always book an appointment with Dr. Surpi Jain. He's currently practicing in Prime Medical Center, Burjuman. You can download the Prime Health Me application in your Android or iOS, and you will be able to book an appointment with doctor as per the schedule available. Or you can always call our helpline 047070999 if you do not have the internet. That will be really great for you. Thank you so very much, everyone, for watching us. We'll be coming back to you with another live session. Till then, stay safe, stay healthy, and Ramadan Kareem. Thank you very much, Doctor.
Thank you.